Miss Wells is a 28-year-old woman with a history of asthma since childhood. She came in today after a near asthma attack 2 days ago. Since then, she has had persistent shortness of breath, wheezing, and wakes up twice per night due to symptoms. She was exposed to cats before this episode, and her symptoms worsen when lying flat or with movement. She has been using her albuterol inhaler, but she feels it's not working as well as before. She also says her symptoms are interfering with daily activities. So narrowing the differential diagnosis, I suspect moderate persistent asthma given her daily symptoms, the frequent use of her rescue inhaler, and nighttime awakenings. Other possibilities could include vocal cord dysfunction or acid reflux, but her history, exam, and symptom pattern strongly suggest asthma. On exam, she has bilateral expiratory wheezing in the lower lungs, but no crackles. Her spirometry is normal today with an FEV1 FVC ratio of 80.56%, but I know spirometry can be normal between exacerbations. She has a history of 5 hospitalizations for asthma, the last one at age 16, but she has never been intubated. Since her spirometry is normal, would it be useful to do a bronchodilator response test? Also, considering her frequent nighttime symptoms and increased inhaler use, should we step up her therapy now or first try optimizing her current medication use? Following the National Asthma Education and Prevention Program guidelines, I suggest stepping up her treatment to better control her symptoms. So start on a low-dose inhaled corticosteroid with a long-acting beta agonist such as Advair or Symbicort. Alternatively, we could try a medium-dose inhaled corticosteroid alone, such as Flovent. Continuing her rescue inhaler, which is albuterol, provide education on proper inhaler technique to ensure she's using her medications effectively. Starting peak flow monitoring at home to track her lung function. Identifying and avoiding triggers like cat exposure. Also would refer her to a pulmonologist or allergist for further evaluation since she's had multiple hospitalizations and does not currently see a specialist. Scheduling a follow-up visit in 2 to 4 weeks to reassess symptoms and adjust her treatment plan if needed. I'd like to learn more about when biologic therapies like Xolair are appropriate for asthma management. I'm also interested in how to distinguish from other conditions like vocal cord dysfunction when spirometry is normal.